Welcome to today's video where we'll discuss the early warning signs of pancreatic cancer, one of the most challenging cancers to detect and treat. Pancreatic cancer ranks as the third leading cause of cancer deaths in the United States, making early detection critical for improving survival rates. The pancreas, a vital organ located deep within the abdomen, plays a crucial role in digestion and blood sugar regulation. Unfortunately, its hidden location makes it difficult to detect pancreatic cancer in its early stages. Many patients don't experience noticeable symptoms until the disease has already advanced, which is why it often carries a poor prognosis. However, there's hope. By recognizing the subtle early warning signs, we can improve the chances of early diagnosis and potentially save lives. In this video, we will break down these critical symptoms from jaundice to digestive changes and explain how they relate to pancreatic function.
We'll also discuss risk factors that may increase your likelihood of developing this disease. Are you ready to gain crucial health insights? Hit that like button, subscribe, and let's dive in. Starting with the first sign.
Number 1, jaundice. One of the earliest and most visible warning signs of pancreatic cancer is jaundice. This condition causes a yellowing of the skin and the whites of the eyes due to a buildup of bilirubin, a yellow-brown substance produced when blood cells are broken down. In a healthy body, bilirubin travels through the bile duct and is excreted. However, when a pancreatic tumor obstructs this pathway, bilirubin accumulates in the bloodstream, leading to the distinct yellow discoloration associated with jaundice. It's important to note that jaundice can result from other conditions such as hepatitis or gallstones, but when linked to pancreatic cancer, it is often accompanied by other symptoms. While jaundice doesn't always mean cancer, it is a clear signal that something is wrong with your digestive system. Early detection is crucial. Don't ignore this visible change in your body. If you notice jaundice, seek medical evaluation immediately, as it could be your pancreas sending an urgent message.
Next, number 2, persistent nausea and vomiting. Unexplained nausea and vomiting can be early warning signs of pancreatic cancer, especially when they occur without an apparent cause. These symptoms often stem from the tumor's impact on the digestive system.
If pancreatic tumors grow, they can press against the stomach or small intestine, disrupting normal digestion. This pressure can lead to a partial blockage, resulting in nausea, feelings of fullness, and episodes of vomiting. It's important to distinguish occasional nausea from persistent symptoms. While temporary stomach upset is common, nausea and vomiting caused by pancreatic cancer tend to be ongoing and may worsen over time. These symptoms are often more noticeable after eating, particularly fatty or heavy meals. Additionally, many individuals experience loss of appetite or feel full quickly, which can contribute to unintended weight loss. Pay attention to patterns in your digestive discomfort. If nausea and vomiting become frequent or persistent, especially when combined with other unusual symptoms, it's crucial to consult a care provider for further evaluation. Next, number 3, persistent, unexplained itchy skin, also known as pruritus. Persistent, unexplained itchy skin, also known as pruritus, is a commonly overlooked symptom that could be an early warning sign of pancreatic cancer. Unlike occasional itching caused by dry skin or allergies, the itching associated with pancreatic cancer is often generalized, meaning it affects the entire body rather than a specific area. It's typically intense, unrelenting, and doesn't improve with usual treatments like moisturizers or anti-itch creams. This symptom is believed to be caused by the buildup of bile salts in the skin. When pancreatic cancer blocks the bile duct, bile can't flow properly, leading to an accumulation of bile salts in the bloodstream, which eventually settles in the skin, triggering severe itching. In some cases, itching may appear before jaundice, making it an early warning sign to watch for. The itching can be particularly noticeable on the palms of the hands and soles of the feet, but it can also spread across the entire body. If you're experiencing persistent unexplained itching that doesn't respond to typical treatments, take note. While it could result from various factors including allergies or dry skin, it's important to mention it to your doctor, especially if it occurs alongside other unusual symptoms. Continuing our exploration with number 4, abdominal pain, especially in the upper abdomen, can be an early sign of pancreatic cancer.
Unlike common stomach discomfort, this pain often has distinct characteristics set it apart. It is typically described as a dull, aching sensation that may radiate to the back. Many patients report that the pain is worse when lying down and improves when leaning forward as a result of the tumor pressing on surrounding organs and nerves.
As the tumor grows, the pain may become more severe and persistent. Some describe it as an annoying pain that worsens after eating, particularly after consuming fatty foods. This occurs because the pancreas releases digestive enzymes after meals, and if a tumor is present, this process can trigger increased discomfort. It's important to note that abdominal pain is a common symptom of many conditions, including indigestion and pancreatitis. However, if the pain is persistent, severe, or accompanied by other unusual symptoms, it is crucial to seek medical attention for further evaluation. Moving on to number 5, diabetes. Sudden diagnosis of diabetes, particularly in individuals with no prior history of the condition, can be an early warning sign of pancreatic cancer. This connection arises from the pancreas's dual. It produces digestive enzymes and regulates blood sugar through the production of insulin. When pancreatic cancer develops, it can disrupt insulin production, leading to a rapid onset of diabetes symptoms such as increased thirst, frequent urination, blurred vision, and unexplained weight loss. Unlike type 2 diabetes, which often develops gradually due to lifestyle factors, diabetes linked to pancreatic cancer appears suddenly and progresses rapidly. If you have been diagnosed with diabetes unexpectedly, especially if it develops without obvious risk factors, it's essential to pay close attention. While diabetes is more often caused by other factors, discussing the possibility of additional testing with your doctor could be crucial for early detection. And lastly, number 6, changes in the color and consistency of stool and urine. Changes in the color and consistency of stool and urine can be a key warning sign of pancreatic cancer, often resulting from the tumor's impact on the biliary system and the pancreas's digestive functions. When pancreatic cancer blocks the bile duct, it can cause urine to become darker, taking on a brown or amber hue due to increased bilirubin levels in the bloodstream. At the same time, stool may become lighter or clay-colored because bile isn't reaching the intestines, which normally gives stool its characteristic brown color. Pancreatic cancer can also disrupt fat digestion, leading to a condition called steatorrhea. This results in oily, floating, and particularly foul-smelling stool due to undigested fats passing through the digestive system. While diet medication and other conditions can also cause stool and urine changes, persistent alterations, especially when combined with other unusual symptoms, warrant medical evaluation. If you notice these ongoing digestive changes, it's essential to seek medical attention as soon as possible, as they may be risk factors for pancreatic cancer. Understanding the factors for pancreatic cancer can help identify individuals who may benefit from closer monitoring. While anyone can develop this disease, certain factors increase the likelihood. Lundekern genetics, a family history of pancreatic cancer or genetic syndromes, significantly increases the risk. Specific gene mutations such as BRCA1 and BRCA2 are strongly linked to a higher likelihood of developing pancreatic cancer. Age. The risk of pancreatic cancer increases with age, with most cases diagnosed in people over 65. This highlights the importance of staying vigilant as we grow older. Smoking. Smoking is a major modifiable risk factor. Smokers have a significantly higher risk of developing pancreatic cancer compared to non-smokers. The good news, the risk decreases after quitting, reinforcing the importance of smoking cessation. Chronic conditions, long-standing diabetes, especially type 2, and chronic pancreatitis are associated with an increased risk of pancreatic cancer. If you have these conditions, regular screenings and lifestyle modifications may help. Obesity, excess body weight, and a sedentary lifestyle contribute to a higher risk of pancreatic cancer. Maintaining a healthy weight through a balanced diet and regular exercise can reduce your risk. Exposure to chemicals. Prolonged exposure to certain chemicals, particularly in metalworking and industrial settings has been linked to higher pancreatic cancer risk. Workplace safety measures are crucial for minimizing exposure. Final thoughts. Experiencing one or even several of these symptoms doesn't necessarily mean you have pancreatic cancer. Many symptoms can be caused by less serious conditions. However, awareness and early detection are key to improving treatment outcomes. If you found this information valuable, please like this video and subscribe to our channel for more life-saving health content. Check out the other videos on the screen for more crucial health insights. Your support helps us reach more people with vital health information.